Download this completely free audio to reassure your pet and free it from anxiety. Download the complete collection, which you will easily get the link below in the description of this video. We only have a few copies available. Download your copy now below in the description of this video. Subscribe to our channel to learn more about health, diet and nutrition in the care of your pet. Subscribe and activate the notification campaign to receive much more valuable content. Subscribe now. The worst intestinal malabsorption syndrome my dog could ever have. What should I do to control it? In reality, malabsorption is not a disease in itself, but the consequence of some ailment that will affect the small intestine or pancreas. It can be complex to reach a diagnosis. If we suspect that our dog is suffering from this problem, we should prepare to perform tests such as a biopsy, and the treatment will depend on the cause behind this syndrome. Let's look more closely at what can cause malabsorption by the intestine. What is malabsorption syndrome? As the name suggests, a dog with a malabsorption problem will not be able to digest food, or its small intestine will not be able to absorb the nutrients resulting from the digestion process. The main function of the small intestine is the digestion and absorption of nutrients. The pancreas is responsible for secreting most of the digestive enzymes. Therefore, problems in both organs are related to malabsorption syndrome. Symptoms of malabsorption syndrome. If our dog shows one or more of these symptoms, it is very likely that he is suffering from malabuse syndrome. Low weight, indicating that the malabsorption is already severe or chronic. Malnutrition, decreased muscle mass. Huge appetite, which is called polyphagia, but there can also be inaptitude and anorexia. Coprophagia and pica, to try and get nutrients. Diarrhea with 3 or 4 bowel movements a day. Diarrhea with a very unpleasant smell in cases of bacterial overgrowth. Very copious, foul-smelling, excessively fatty stools, called steatorrhea. Undigested food in the stool. The hair around the anus can appear greasy. Flatulence. Excessive bowel sounds. Chronic vomiting, which is usually yellowish-white. Abdominal pain. Dehydration. Anemia. Ascites and edema, which is the accumulation of fluid in the abdomen and other parts of the body. What are the causes of malabsorption syndrome? It is considered that certain conditions may predispose to the occurrence of malabsorption. The vet has to differentiate, among all of them, which one is affecting our dog. They're next. Exocrine pancreatic insufficiency, since with this disease the digestive enzymes that take care of the correct digestion of food are not produced. Infectious enteritis that causes permanent damage to the intestinal mucosa. Inflammatory bowel disease, an immune-mediated and idiopathic pathology that destroys the intestinal mucosa. Surgical removal of a large fragment of small intestine, which can lead to paralysis. Diseases of the small intestine, such as idiopathic hairy atrophy. In it, the villi of the small intestine, which serve for the absorption of the nutrients, are underdeveloped. It's more common in the German Shepherd. Gluten-sensitive enteropathy, which is hereditary and has been described in the Irish Setter. Intestinal tumors such as lymphosarcoma. Bacterial overgrowth in the small intestine, which implies a very abundant and anomalous bacterial flora replacing the normal one. It is more frequent in the German Shepherd, the Basenji and the Shar-Pei. It may also be associated with some of the above-mentioned diseases, but their cause is unknown. Diagnosis of malabsorption syndrome. In many cases, when a dog has diarrhea, it is often treated as a digestive disorder, of greater or lesser severity. Therefore, sometimes the dog with symptoms like those described is treated according to the protocol of gastroenteritis. When the symptoms persist or the dog's condition worsens, the possibility of a malabsorption syndrome begins to be considered. Stool analysis, Abdominal ultrasound or endoscopy may be used to reach a diagnosis, but definitive confirmation is achieved by performing an intestinal biopsy. What is the treatment for malabsorption syndrome? Any treatment for malabsorption has to be based on identifying the disease that is causing it, which is what is being treated. In any case, it is based on diet and medication, depending on the symptoms presented. Drugs such as antibiotics, immunosuppressants or corticosteroids stand out. As an example, gluten-free diets are prescribed for hairy atrophy. An overgrowth of intestinal bacteria is usually improved by antibiotics. For exocrine pancreatic insufficiency, enzyme and vitamin supplements are prescribed. The daily ration is divided into 2 or 3 meals, and an appropriate diet is established. Sometimes gastric protectors are also administered. We must bear in mind that, since it can be due to a great many diseases, it is not easy to intervene in this syndrome. Prognosis of malabsorption syndrome. The outcome depends on the cause of the malabsorption. For example, if it is due to pancreatic insufficiency, the prognosis is usually good, provided the dog follows the recommended treatment. However, the prognosis is poorer the more complicated the pathology affecting the small intestine. To continue learning more about this and other varied topics, we recommend you to subscribe to our information channel. Until a new howl.